Chris Hipkins in denial. Forever speaks Bulldust. Chris Hipkins, the failed ex-Prime Minister of New Zealand and temporary leader of the opposition, continues to make false and disturbing statements. Lest we forget. Chris Hipkins, New Zealand will never forgive you. Sack him, or prosecute him, or both. Chris Hipkins is clearly not fit for purpose as a politician. Remember the catchphrases: required, mandatory, or compulsory. The Ardern-Hipkins government totally failed New Zealanders, yet they still managed to dish out Damehoods and Knighthoods amongst themselves, in self-bragging, self-appointed, self-appreciation of their own efforts. Thank you for listening. Geraint, on behalf of WhangareiTim.
The COVID period was probably the hardest thing I'll ever do in politics. You know, there were no easy choices there. No matter what choices we made, it was going to cause heartbreak for somebody. We had one of the lowest death rates from COVID-19 in the world, and that was because of the tough decisions that we made.
It's also disturbing that the recent study was partly funded by the New Zealand Department of the Prime Minister and Cabinet and Ministry of Health, which used mathematical modelling algorithms to show that the vaccine saved many thousands of New Zealanders' lives. Yet this same report totally ignored the horrifically high excess death rate, and News Hub media outlet who covered the story never bothered to mention who the ministers were, and how the study was funded.
If you look at New Zealand's overall vaccination rate when COVID-19 arrived, and the mortality rate, the number of people who died from COVID-19, it was a fraction of what it's been elsewhere around the world. The results were pretty clear. We had one of the lowest death rates of COVID in the world.
We had lockdowns, we had separation, we had a whole range of psychological problems emanating, and there is also this extreme, unexplained, so-called unexplained increase in death rate. We need to find out exactly what the decisions were and how those decisions were made.
Now I would like to present some data charts which highlight New Zealand's horrific excess death statistics. This information has been put together from recently obtained data from the World Health Organization, OECD statistics, and our World in Data. The charts have been updated with comments where appropriate, to make the data easier to follow and understand. What is excess mortality? Excess mortality is a term used in epidemiology and public health that refers to the number of deaths from all causes during a crisis, above and beyond what we would have expected to see under normal conditions. In this case, we're interested in how the number of deaths during the COVID-19 pandemic compares to the deaths we would have expected had the pandemic not occurred. A crucial quantity that cannot be known but can be estimated in several ways. Excess mortality is a more comprehensive measure of the total impact of the pandemic on deaths than the confirmed COVID-19 death count alone. It captures not only the confirmed deaths, but also COVID-19 deaths that were not correctly diagnosed and reported, as well as deaths from other causes that are attributable to the overall crisis conditions. The borders are closed on the 19th of March 2020, week 13. Shortly afterwards, you can observe an immediate decline in excess death rates, possibly because any fatal illness, disease, or coronavirus has now been greatly restricted from entering into New Zealand. Interesting pattern of OECD excess death rates in 2021. Even with the borders fully closed throughout the full year, the death rates were higher in the first and last quarters. The borders were reopened on the 27th of February 2022, week 8. Then a horrible year for excess death rates, becoming one of the worst in the world, soaring above 20% and peaking over 30%, even with high vaccination rates being achieved. 2023 is another bad year for New Zealand excess death rates, starting the year at over 30% and staying high for nearly 6 months, then dipping a little, before rising into the 20% range for the last 2 months of the year. New Zealand's excess death rates for 2022 and 2023 are absolutely shocking, one of the worst in the world. But what is even worse, is the deafening silence from the failed Labour Party government and the left-bent, bribed, corrupt, dishonest, woke, mainstream New Zealand media. This chart is from the World Health Organization, and summarizes COVID-19 cases submitted to the WHO from the Western Pacific, New Zealand's borders were closed from the 19th of March 2020 through to the 27th of February 2022, so there would have been very few COVID-19 cases to report to the World Health Organization during this period. New Zealand's excess death rate steadily increased from early 2021 to become one of the highest in the world during 2022 right through until the end of 2023, with horrific rates peaking over 30% at times. This chart summarizes the OECD data for New Zealand 2020 to 2023, and it's not exactly a success story in my view. In fact, the New Zealand excess death rate statistics are horrific. COVID-19 vaccination in New Zealand began on the 20th of February 2021, week 7. The excess death rate steadily increased from early 2021 to become one of the highest in the world. The reasons for these excess high death rates have never been publicly addressed by the failed Labour Party government, or worse still, by the mainstream New Zealand media. However, the Labour Party Prime Minister and other cabinet and health ministers have often bragged about how New Zealand had one of the lowest COVID-19 death rates in the world. This then begs the obvious question: if not COVID-19, then what is causing these horrific New Zealand excess deaths, and why the silence? This chart from Our World in Data makes it quite easy to summarize visually how bad the New Zealand excess deaths rates really were. The chart covers from the start of January 2020 to the end December 2023, quite frankly, 4 years worth of misery. Borders closing, vaccinations underway, borders opening, and then excess deaths soaring, with several instances of deaths peaking at over 30%, which is horrific. But total silence, not a peep from the failed Ardern-Hipkins Labour Party government, or the left-bent New Zealand mainstream media. Why? The job of any government is first and foremost to look after and protect its citizens, but this silence and lack of caring is an enormous failure of government, and in my view, many of the associated MPs, academics, and the media are guilty of gross professional negligence. This moving graph chart is from Our World in Data, and shows New Zealand's excess death rates from the start of January 2020 through to the end of December 2023 for all age groups as shown. Unfortunately, the graphs reflect a depressing picture which I will now cover in more detail in the following summary slide. There's a lot of information displayed here, so I suggest that you pause the video and have a really good review of this presentation slide. It's a bit of a sad eye-opener unfortunately, and it's definitely not something to be proud of, or silent about. In summary, all age groups from youngsters up to 14 years of age, right through to the elderly over 85s, all experienced rising excess deaths rates from early 2021 onwards. All age groups also experienced average high death rates ranging from about 15% to 25%, and peak excess death rates ranging from 23% to 44%, which is quite horrific. The chart also details when COVID-19 vaccinations began, and when the borders were closed and reopened. It's worth taking some time to pause this video clip and take a long hard look at these figures. They are very sobering, because New Zealand's high excess death rates badly affected all age groups, not just the elderly, as we often hear mumbled around the traps. How any Prime Minister, or Cabinet Minister, or Health Minister, could betray the public in this manner by keeping silent on such horrific statistics, and equally so, how even a left-bent corrupt mainstream media could also remain silent, defies my imagination. We've had Damehoods and Knighthoods. We've had preaching from the political pulpit. We've had no jab, no job mandates and deadlines. We've had lockdowns, social distancing, and separation. We've had how great the government handled COVID-19. We've had nobody was forced to vaccinate, they had a choice. We've had one of the lowest COVID-19 death rates in the world. We've had total and utter silence on New Zealand's horrific excess deaths. Why the silence on New Zealand's horrific excess death rate statistics? Why? Surely, if the failed Labour government ministers can keep bragging about how we had one of the lowest COVID-19 death rates in the world, and also for some secretive reason, find the time and money to fund an expensive professor mathematical modelling program to support their great achievements, they would also find the time to publicly address our horrific excess death rates.
In terms of the vaccine mandates, I acknowledge that it was a challenging time for people, but they ultimately made their own choices. There was no compulsory vaccination. People made their own choices.
Health and education staff are among those who had to be let go because of the mandates.
And the District Health Board has lost close to 100 healthcare workers because of the vaccine mandate. More than 100 teachers have also lost their jobs.
Thousands of workers at businesses like bars, gyms and hairdressers will have to get the jab to keep their job under a vaccine mandate just announced by the government. Vaccination will be required for all workers at firms where customers need to show vaccine certificates, like hospitality and close contact businesses. There'll be a new law to make it clearer for employers to decide which types of jobs require a vaccine. Non-vaccinated workers in those roles will be given a new 4-week notice to get the jab or lose their job.
We're working to make it as clear and as simple as possible about when it is reasonable for an employer to require vaccination as a condition of employment. This law change will require a minimum of 4 weeks paid notice for any employee who loses their job because they are not vaccinated.
Cabinet has decided today that vaccinations will be mandated.
Once the notice period commences, the employee will have that amount of time to get vaccinated. The employee will be able to retain their employment if they get vaccinated in that period, but their employment will be terminated if they do not.
Government is planning to require every single teacher at every level and all support staff who work with children to be vaccinated.
Newshub can reveal the mandate Hipkins is taking to Cabinet on Monday is a mighty big stick. Every educator who works with a child will have to be vaccinated.
I can now confirm that we'll be extending this requirement to large parts of our health and education workforces as well. Cabinet's agreed that high-risk workers in the health and disability sector will need to be fully vaccinated by the 1st of December. This includes general practitioners, pharmacists, community health nurses, midwives, paramedics, and all healthcare workers in sites where vulnerable patients are treated, including intensive care units. We'll also be including certain non-regulated healthcare workforces, including aged residential care, home and community support services, kaupapa Māori health providers, and non-government organisations that provide health services. Schools and early learning staff and the support people who work with them, who have contact with children and students, will need to be fully vaccinated by the 1st of January 2022. That includes home-based educators, all those who support people in our schools and early learning services such as teacher aides, administration and maintenance staff, and contractors. Secondary schools in Kura will also be required to keep a COVID-19 vaccination register of their students. Students that don't produce evidence of vaccination will be considered unvaccinated.
What the ramifications be for teachers or those in the health workforce who choose not to be vaccinated?
Ultimately, in the health workforce, they will not be able to work in those roles. In the education workforce, from next year, they won't be able to work in those roles. There was no compulsory vaccination. People made their own choices. Last week I announced that the education and the health and disability workforces will be required to be vaccinated to help prevent the spread of COVID-19. This follows on from the government's earlier decisions for workers in our MIQ facilities, our airports and our ports to be vaccinated. We can't leave anything to chance, and that's why we've made the very difficult decision to make the vaccinations for people undertaking those roles mandatory. Anyone conducting high-risk work in the health and disability sector to be fully vaccinated by the 1st of December 2021. Under these new requirements, GPs, pharmacists, community health nurses, midwives, paramedics, and all healthcare workers in sites where vulnerable patients are treated, including intensive care units, must receive their first dose of the vaccine by the 30th of October. These requirements also include certain non-regulated healthcare work, such as aged residential care, home and community support services, kaupapa Māori health providers, and non-government organisations who provide health services. I think early next year we'll be in the phase of chasing up people who haven't come forward to get their vaccination or have missed their bookings and so on. So everyone will be able to get a vaccine between now and the end of the year. But of course, you know, and I want every New Zealander to come forward, but human behaviour suggests that there will be some people that we have to actually really go out and look for, and some of that may spill into next year. But our commitment is everyone will have the opportunity to get the vaccine by the end of the year. Everyone will, but I can't say that, you know, that we're not going to have some hesitant people or some people who just haven't come forward that we don't have to go out and find next year. If New Zealanders come forward and get their vaccinations and we don't have to chase people, if we find that people aren't coming forward and we have to go out and chase people, then that's one of the things that will slow this down.